Turning to health matters now, and more than 750,000 Canadians suffer from dementia and other degenerative brain conditions. It's a worrying number that's expected to double over the next 2 decades. Locating the right help can be a challenge. In tonight's Go Public, an Alberta woman tells of her frustrating search for the appropriate long-term care for her mother. Kathy Tomlinson has the story.
Margaret Diamond has a severe type of dementia. Her daughter says it breaks her heart to see her like this.
I love you. She's just been warehoused.
Her 84-year-old mom spent the last year in acute care hospitals, just waiting for a bed in long-term care.
No one should have to live like this in their final years. Absolutely no one.
Her daughter says she spent much of that time strapped in chairs in hospital hallways.
They don't have enough staff, and she would want to wander into places that she in a hospital shouldn't be in, and they didn't know how else to control her. This is the most dangerous part.
At one point, Dallas Diamond brought her mom home, but says that wasn't safe.
I was afraid she would just smash her head on the floor.
Or sustainable.
I would just stay awake because I was always just straining to hear if she was getting up, and my husband would tap me and say, "Your mom's up, your mom's up, your mom's up." It was just a really dangerous situation all around.
Initially, the family paid up to $5,000 a month to have Margaret in private facilities. Here, she was given a risky antipsychotic drug, so her daughter moved her to another private home. When staff here couldn't handle her, they sent her to hospital.
If you're healthy and you're wealthy, they want you. But the minute you start to step out of what they feel that they can, the bare minimum that they can provide, you're out the door.
Dementia is one of the biggest health challenges that we're facing in this country today.
The Alzheimer's Society says thousands of Canadians with dementia have been stuck in hospitals because there aren't enough long-term care beds or caregivers.
Having people funnel through acute care beds is an atrocious expense to the government. It's ridiculous.
Soon after we started looking into Margaret Diamond's case, she was moved to Calgary's only facility for severe dementia patients. It has only 22 beds and it takes on average 6 months to get in. Kathy Tomlinson, CBC News, Vancouver.
If you want to go public with a story of your own, please get in touch with Kathy. You can send an email to gopublic@cbc.ca or visit our website, cbcnews.ca/thenational, and follow the links.